So let's look at it this way, Debo. I've gone through the selection process. I've been rejected. No human being likes being rejected. And as a result, now I'm traumatized, I'm resentful, I'm angry. The next time I go, because I haven't dealt with those issues, you're still not going to make it. Not because that trauma of you being rejected and the resentment is going to hinder you. Not because you're not...
If it's not addressed.
Yes. So again, it goes back to the point of knowing yourself, even maybe going for therapy. And your psychologist, whoever they is, will give you that feedback. You've got certain traits maybe that are not great for this. Or you've got trauma that's unresolved and you need to resolve that trauma. Because most people, we avoid, we run away, like you said, we become angry. They even become, we hate psychology. That means you're just traumatized. So you're traumatized and now you want to go for selection process again. You're not going to do well.
Thank you so much, friends. This is Dr. T. Thank you for joining us. I've got a very special guest, a good friend of mine, Mr. Mzamo Mbuli. Welcome, sir.
Thank you. Thank you for inviting me.
Been a long time, and I wanted somebody who can actually share with people about the career path in clinical psychology. And I thought you will be the best person to help us. And that's what I want us to get into. But before we get into that, anybody watching us, I want to encourage you that make sure that you subscribe, share with us any career that you might want to know about so that we can revisit it and get somebody to share about it. Make sure that you click on the red subscribe button and we will be able to follow up and get more people to talk about your career path. So, Mr. Mbuli, just a quick intro to you. Just tell us where you come from, who are you, what you studied, your background. Over to you.
So Mzamo was from a small town in northern KZN called Newcastle. He never wanted to do psychology. He wanted to play rugby, sport. So I just found something, a UJ called sports psychology. You know, that I thought that would help me with my rugby. So my first class, school human movement science class, the guy was speaking English, the lecturer, and I couldn't understand the word he was saying. So I just changed to psychology.
Okay.
Yeah, so that's how my journey started. I think in my third year, I became more serious. Like, no, I want to be a psychologist. I want to be a psychologist. And even the feedback I was getting from other students, it's when you don't look like a psychologist, why are you studying psychology? And so I wanted to prove a point. So I did my undergraduate AUJ. And then from there on, I applied at UJ, but I didn't get in. But UP took me. So University of Victoria took me. I did my honors there. But the whole experience at UP, you know, I think from our lectures and the feedback we got, I was intimidated to apply for masters. I was intimidated, so I did an academic master's, where there's a master's where you just do research for 2 years. I never finished, and then I applied for the real thing. Did my master's at UNISA, a great program, a highly recommended program, in fact, in the country. I guess we'll speak about that later. And then I did my internship at one military hospital. And I did my community service, so what's called Zuma years, at Bethakwa Germiston Clinic, Germiston Hospital rather. And the rest is history. The rest is history.
Thank you so much. I think that was brief and to the point. So going back to, you said something that somebody said you don't look like a psychologist. And I think that's why we have a channel like this, because one of the things that I check out, are they particular attributes or behaviors or certain personalities that you will say people should have in order to follow a career path in psychology?
Most definitely, most definitely. And I think your profession helps us in this regard when you help students with career assessment. So for the person who hasn't done a career assessment, I'd say a person's core values, where you care for other people, where you're compassionate about other people. In fact, if you put other people before yourself, I think that's a good attribute to be a psychologist. If you are compassionate, empathize with people, you're a kind, caring person, those are good attributes to have as a psychologist. But also, I guess, we all have life experiences, we develop some core beliefs, and before you become a psychologist, maybe some of those core beliefs need to be challenged because of what you've gone through as a human being.
Yeah.
Traumas, myself, I come from a single parent background, just meaning my parents divorced, and there were some issues. And because of those issues, it had to be addressed before I became a clinical psychologist.
Okay. No, super then. And I totally agree. There are certain traits that at least one should possess to be able to build a career in the field. And obviously that get tested when you actually apply and go through the selection process. And I wanted to check you with that. You mentioned you were not selected at UJ for the honors, but you got taken to UP. Was it the same year? And if it was, how was the selection process from the degree to an honors level?
Yeah, so I applied in my third year. I think we started applying around about July, August. I applied to UJ, and just in case I didn't get into UJ, I applied to UP. I think the criteria at the time was at least an academic record of 60% average for all of your coursework. So I didn't get in, like I said, at UJ, but fortunately at UP I got in. So at the time for honors, it's just a 60%. It might have increased with all of the thousands of people who now do psychology.
Yeah, no. I think it might be about 65 now. I wonder, but UP, were they doing selection? Were they another process that they were following beside the academic marks? Did you guys have to come for interviews or?
So for honors, it's purely academics. It's purely academic. Yeah. Where we do interviews and the whole stressful process is when you're doing your honors.
Okay.
That's a process.
And you mentioned that you were scared to go for masters, the clinical one or practical one. You went for research. What was the reason for the concern? Did you hear something, or what? What informed that?
So the feedback we would get from our lecturers in our honors class, they spoke. Obviously, you have to know yourself. And knowing yourself, there's many ways to do it. So one thing that was recommended for the honors student and for anybody who's doing honors, who wants to apply for clinical, for masters as a clinical research psychologist or even counseling psychologist, if you can see somebody, and obviously our universities have psychologists, that's a good thing because they want people who are able to self-respect, you know your strengths and your weaknesses, and like I said, even some of your traumas, it's very necessary. So the feedback we get from our lecturers, because I did my degrees in 3 years, I did my honors, record time, so I was quite young. And the thing that we got from our lecturers is that, no, some of you guys lack life experience. You haven't really lived. So they told us if you've gone overseas, somebody, I didn't understand that, but I think I understand it now. Having patience, even seeing some international clients. When you go overseas and you live abroad, it opens up your mind. It gives you a broader perspective about yourself and the world. So that was an advantage. But my age counted against me. So I was afraid from the feedback that we got. The marks were good. It was okay, but I lacked, I thought, the life experience, because I thought, okay, I'm only at the time, what, 21, 22. How am I going to be a psychologist? How am I going to be a psychologist? So that stopped me from applying. I'm like, okay, let me just do an academic master's. By the time I do clinical, my master's, at least I would have had some research. So that was a big pushback. And this is not to say I've got colleagues, even some of my subordinates, very young, 26, 27. They did the whole shebang, 3 years, honors, masters, internship, ComServe. So you can. But I think what's very important for any honors student, you must see another clinical psychologist and work on your own issues before you even go for the selection, because that'll help you a great deal. Because the master's selection, if you look at it from a psychological point of view, it's all about you and putting yourself out there. And if you don't know yourself, you're not going to do that well in that selection process.
So I'm glad you are recommending that if somebody wants to be a psychologist, try to also resolve your own issues. Meet somebody, deal with your own issues. But the other thing, somebody might feel they don't have a specific issue they want to deal with, but also taking time to just mature, develop yourself, have some life experience, go and work part-time. Don't take lack of selection as just a rejection, that you can't be a psychologist. But it could be that there's an area where you lack to develop. So thank you for sharing that. I want to revisit, there's a part where you speak about you went to research, then you went for clinical. I want to understand, there's an educational, research, there's counseling, there's now there's neuro, there's industrial. Why did you choose specifically clinical psychology?
So in third year, we had this textbook, Abnormal Psychology. And abnormal psychology is clinical psychology. So it's not just, it looks at pathology in an intense way. So that's the reason why I wanted to do clinical psychology, which means I get to go to the hospital and get to see the extreme end of psychopathology. That's the reason why. And
continue.
No, I'm saying that's the reason why. And with educational psychology, you can't do that. With counseling psychology, you can't do that. I wanted to see the extreme pathology or abnormal. Maybe because I was abnormal myself, so I felt at home.
Funny how at Psych we did pathology, but we did only for kids. And one of the determining factors, because I actually did an honors at UNISA psychology, and I did psychopath. I left it when I went to do at Psych. And one of the determining factors not to go to clinical was psychopathology. I said, you know what, I've got a limit here. I don't want the extreme. I want to go down a bit. I want to tone it a bit. So yeah, you're right. I think that module can actually determine if you really want to go this far. And for me, it was one of the modules that helped me to say, no, I like to work with the youth. I always thought the youth, or the young people in particular, their mind is still, open to be amended or changed. Adults, that are difficult to tweak, that are difficult to, it's like when you deal with an adult student trying to give them career guidance. They are difficult. There are many issues that are on their way and factors. While a young person is very bendable, they're flexible, and I think that was more my determining factor. But I'm glad you mentioned that, because I think it's very significant even on my side. And you went for clinical at UNISA. And how was that? How was the selection process and the course itself?
Sure. So my recommendation is, if you're in honors and you've obviously gone through the process, you're taking the advice that we're giving you, try and apply to as many universities as possible, because I applied to, I think, 5. Medunsa accepted me for the interviews, UNISA accepted me, and I think Rhodes accepted me. Kofsits, I got a rejection. Vids, I got a rejection. So the selection process is very intense. What I liken it to, so people can understand, if you a person who watches idols and you see the top 20 become the top 19, and it's very similar. It's very similar. So it's usually for a week. First days, you guys do group activities. And now I understand why group activities. It's very easy to see how a person is in a group. And the way UNISA does it is maybe a bit, but what's the word? It's a bit more challenging. Because the whole ethos of UNISA is family systems, it's systems therapy. So even the selection process is very systems orientated. They put you guys in small groups, and the topic that we got at the time, we had this whole thing, Helen Zela and Jacob Zuma. This was, I think, 2010, and you sitting in a group of in a room with people you don't know, and they ask you, what do you think of Helen Zuma and Jacob Zuma? You know, so you come here prepared, thinking I need to know the textbook, I need to know abnormal psychology, and then hear something about politics.
Yeah,
I'll never forget that. So that's the first that's the first thing that they asked us, and obviously they see how you interact, not so much the content of how you know, but how you interact, how you present yourself to other people. Do you listen to other people and all of those other things? And then the second day, obviously there's a cut-off. I think we started with 100 people. The next day was maybe like 90 people. We did a research article. We had to analyze a research article, which again is very important for masters. For educational, for counseling, for industrial, you need to have a good research understanding. So for the guys,
was it as a group or individually when you came to the research part?
Group, but you had to do it individually. So like a test. They gave us the research article to analyze, ask us questions, and from how you performed, then they'll call you the next day. I don't remember what we did the third day, but it was definitely a group activity. The fourth day was also definitely a group activity. The fifth day, there were more group activities. Up until there was 15, and they had to cut off like 3 people. And you form bonds with these people that you all feel together because you're going through the experience all together. And you don't know what they're looking for. So my advice to anybody, just be yourself. The things that you've learned about yourself, display them out there, your strengths, your weaknesses. They're not looking for a perfect person, as we say to clients. And I think, like what you said in the beginning is important about the youth. In fact, I learned that from you when I was still a student. I think you were doing your master's. When you're telling me like young people are more amenable, they're more open to receiving feedback. And that's how you should be as a candidate or any master's student. You can take feedback, you're able to reflect. In other words, you are self-aware. Even when somebody tells you things that you don't like about yourself, but you're able to reflect and make meaning out of it instead of being defensive and all of those things. So it was
right. I mean, continue, sir. No, continue.
It was just the 5 days, and then after 5 days, they chose 12 of us out of 100 people. After 5 days.
Wow! It looks like a long walk to freedom.
It was. You don't sleep. I think you don't sleep well during that week. It's intense.
Yeah, look, I make fun about psychology. It's like you are interviewing to get to heaven. Even getting to heaven is not as difficult. It's not as difficult.
You're exactly right. You're right.
Yeah, but I tell people, you know what? It is worth it. At the end of the day, even if you do it properly, it will mature you, and you will be a better person after the selection process. Whether you are selected or not, you will be a better person. Because
100%.
I think you did mention it very well, that selection is not just about people choosing the numbers. It's also about your own psychological processes. You need to be ready psychologically, because in the midst of that group session, you are also competing. It's a group session, but there's a competition, you know. And I think that's the most demanding process, because psychologically, so we are helping each other. They're looking at the group dynamics, but are you able to also be able to stand out and show your unique trait that will add value at the group that they will select? But also, they want a unique group for the class, so that when you are a class, you can actually bring different dynamics to it. That is why you don't get people who are similar in the master's class. I've noticed that we are all different in some regard. Was it the same on your side?
100%. I was very unique.
Yeah.
There was only one. No, you're right. 100%. 100%. And that group of different types of people, somehow, obviously there's challenges, but you work together.
Yeah.
Because the success, as much as it's individual, but it's also as a group.
Yeah. And I think that is why it's important that you become yourself during the selection process. The minute you copy somebody, you are actually disadvantaging yourself, because they want one of a particular kind. So I'm really happy that you dealt with it and you got into the master. So for somebody who just desire to study clinical, what would you say the course entail? And obviously you're going to be speaking from a UNISA perspective. What does it entail in the course? What do you study? What do you do? Do you guys do therapy on each other? I know psychology, people cry a lot. What happens in class? What do you actually do?
Right. There's a class, I won't mention it here, but there's a lot of crying there. I cried a lot.
Look, it happens in almost every psychology. I don't know industrial, but almost every psychology.
Yeah.
There are crying sessions.
Yeah. And it's unexpected. It's unexpected. But again, even that class, it goes back to what we're speaking about being self-awareness. If you don't have self-awareness, you won't know how you impact other people, good or bad. And the crying most of the time is when you don't know the impact or the effect you have on others. You might do a good thing with good intentions, but it hurts somebody. And when somebody says, I mean, it's like a couple. Yeah, you did a good thing, but you hurt me. I mean, you have to own up to that. So those are the crying classes. But also, what I enjoyed at UNISA, sorry.
Yeah, while you are taking some water, I wanted to mention that, and I wanted to add, somebody was asking me, I was doing a presentation to students in psychology.
Yeah.
They were saying, no, they want to do a petition so that HPCSA can increase the number of psychology students selected for masters. And I was saying to the lady that it's not just about selection, it's about the training itself. It's so intense. You don't need too many, you need less people for it to be effective. And when I mentioned the issue of the crying, and it's about that, you know, most people, they should understand as well that it's not just about the crying, it's the intensity of the program. It really also interrogates you as a human being, but also you reflect a lot about your own processes and what you do and how you impact other people in class. So it's not that psychology is uncaring about people who have honors that are not selected. It's about the training and what it demands. We need few people for it to be effective. Because by the time you go there, you only have your mouth and your ears and your brain as your tool. No medication, no stethoscope. So if you don't go through the process thoroughly, you become a bad psychologist. And I think I'm yet to see any bad psychologist, because the process we go through, it develops you to some extent that people get confused why we become good psychologists. It's because you were in therapy for the whole 2 years and you have to just be in therapy for 1 hour. So maybe also touch on that when you comment.
Sure. So even the classes at Debo, they're therapeutic, because it's not just, again, it's not the content. How you engage with the content of the material of what you're learning, how you engage with your lecturer, that in itself teaches you about yourself, and again, teaches you about how other people receive the way that you are. And that in itself is therapeutic. And then there's obviously therapeutic classes. They teach you therapeutic skills, but there's also therapeutic classes or process groups, because there's many different ways of processing. So I can liken the master's class to you are always processing, always processing information, always processing information about yourself, always processing information of from how other people receive you, and it's constant. That's why it's intense, because no human being likes being crucified all the time, and that is why we don't really speak about it. But there's many dropouts as well during master, because it's so intense. I know of some people even dropping out to the extent of becoming mentally ill because of the intensity of the program. So it can't be 400 people at the same time. Let's all do it. Like you said, it will not be effective. And I think the most important thing, especially if you're doing your honors, if you're doing your undergraduate, it's something that I didn't understand. Take your research subjects seriously. People like, for myself, I didn't understand what does research have to do with me listening to people's problems. When you do research and you're analyzing and you're collecting data, it's exactly the same thing in a therapeutic room when you're sitting and analyzing a person's problem. And I was separating the two. The two are not related. In fact, they're the same thing. And they're the main obstacle, I would say, for most people. People get delayed, even including myself, get delayed in doing their research. So if you can, I suppose, maximize and learn as much about research in your undergraduate and your honors before you get to your master, that will put you in good stead. A lot of people trip up because of research.
I hear you. Thank you for sharing that. So, yeah, I'm glad you touched on that. So what I wanted to ask you, and also because you have been a psychologist for some time now, how will you encourage somebody who have been trying for a master's for some time, they've never been selected, or they've only been rejected once and they're still considering whether is it worth it, you know? And I want you to take holistically what it means to you when you have now completed and you are thinking about that person who think, is it worth it, you know, after the rejection. How will you advise such a person? There are many out there. And some of them they hate, others they hate psychology, others they hate the selection process, others they're just angry at everyone. How would you advise those people?
So let's look at it this way, Debo. I've gone through the selection process, I've been rejected. No human being likes being rejected. And as a result, now I'm traumatized, I'm resentful, I'm angry. The next time I go, because I haven't dealt with those issues, you're still not going to make it. Not because that trauma of you being rejected and the resentment is going to hinder you. Not because you're not...
If it's not addressed.
Yes. So again, it goes back to the point of knowing yourself, even maybe going for therapy. And your psychologist, whoever they is, will give you that feedback. You've got certain traits maybe that are not great for this. Or you've got trauma that's unresolved and you need to resolve that trauma. Because most people, we avoid, we run away, like you said, we become angry. We even become, we hate psychology. That means you're just traumatized. So you're traumatized and now you want to go for selection process again. You're not going to do well. It's not going to happen.
No, I'm glad you're mentioning that. I didn't even think about that actually by being rejected, you are actually going through some trauma of your own.
Yes.
That you need to actually address it before you go back. And luckily, most of the people who go there, they're students and they've got free access to a psychologist within their institute. They can actually go there and have those people help them because they are trained psychologists within universities. No, I'm glad to bring that part. So you find now you are going back, but you are still carrying trauma of the previous rejection, and it comes out from the selection process. And you are not being selected, not because you are not good, because you are now adding to the trauma. So you were bad previously. Now you have trauma on top of you. So it's making it worse.
You can see it.
No.
I saw it twice. Somebody at UNISA and somebody at Medusa. You know, the people, because we all talk, hey, this person is trying for the 7th time, the 5th time, and how they carry themselves. Obviously, you're not a psychologist, but no, something is wrong here. You know, and the person, for whatever reason, hasn't gone through that process of understanding, because you need to understand. But why is it, like you were saying, I haven't made it? And now you're going back to an intense selection process, and you're traumatized. You won't do well.
Now, I was fortunate to sit on the selection panel. We just keep saying, hey, issue. This person has issues. and we don't want to select you to be dealing with your issues. We want to select a student who want to go through the master's process. No, I'm glad you are raising that part.
Or if you have issues, at least be aware that you have issues. There's nothing worse, even in therapy. You have issues, but you're not aware. And even when you get feedback, you're still not aware.
Yeah.
That's the worst kind of student. That's the worst kind of patient client for me. Somebody who can't receive feedback.
Yeah. No, I'm glad I mentioned that, because somebody who's listening must also know they don't necessarily select perfect people. They don't select people who have got no issues. They select people who have issues but are very much aware of them and are in control of their issues. Yes. So you rather be able to reflect that I'm still developing in this area. I'm aware of how it affects me and how it might affect those around me. That's the whole thing about it. It's not about having perfect people with no problems.
It's not a job interview or any other job interview. And I've been in the process of interviewing psychologists. Even when you're doing interviewing as a psychologist for a job, you want to see the self-awareness, not just how good you are at regurgitating information, how you can apply what you've learned to a clinical case. Who are you as a person? Because that psychologist, you work with doctors, you work with other psychologists, and.
I hear you. Now, so you did your master's, and then when you finish your M, what was the process you followed? I understand you guys do internship and community work. How long are the process? Where did you do yours, and what does it entail?
Yeah. So HPSA, because of the problem research, they keep changing the rules. But as it is now, you can't do your internship if you haven't done your research. In our years, they used to allow us, but people would do their ComServe and still not finish their research. So HPSA has decided if you've not done your research, you can't do your ComServe. So that's a requirement by itself, even before you do your ComServe. And then when you do your ComServe, again, it's an application process. You would apply to any tertiary psychiatric hospital. So your Vescopies, your Tara, your hospitals in Gauteng, Bobar, where you're gonna spend.
So maybe just to come in there. So when you finish your M,
yes,
you are going through. You are going for a 1-year internship or community service.
So it's first 1-year internship,
and then you write the board exam afterward.
Yes.
And you can't do ComServe without passing the board exam.
100%. 100%.
Okay.
Or
so with that
internship, you have to pass your research. You must be done with your research, even before internship as well.
With us, when we did internship, we looked for places for ourselves. Do you guys get placed for your internship and ComServe, or you have to look for place yourself?
You get options. They'll give you a list, and you have to apply. It can be in the province that you live in, or it can be in another province. Obviously, it's a bit easier in the province that you are, because then it's easier to attend the interviews. So most people apply where they live, or in the province that they live, so they can attend the interviews, because it's another selection process. You apply, they call you, and you again do the interview process. It's not a given.
Oh, okay.
Yeah, I think I was interviewed. Viscopies, they didn't take me, but I went to 1 mil, did the interviews, and they took me.
Okay, 1 mil is by the Ama soldier.
Yeah, one military hospital, yes.
Did you have to wear uniform, or how does it work, 1 mil? Who are you seeing there?
So 1 mil, if you haven't done training, Yabu Soli, you can't wear uniform. It's 6 months training. So you don't wear uniform. You're considered a civilian, and sometimes you're treated as a civilian. But you need to understand the process of how you need to understand different ranks. Major, you're a captain, and what that means, because that's a different type of environment as well. Yes, you see mostly soldiers, but you also see soldiers and their families as well. We were fortunate.
So you work with. Yeah, continue.
I was saying
you work with soldiers and their families.
Yes, and their families. Say again?
Okay. No, I missed that part. I think something froze there when you were speaking about who you work with.
Oh, yes. It's soldiers and their families. We saw a lot of people from exile. We saw a lot of people in my year. I don't know if you remember MK23, the soldiers who were involved in that whole situation. A lot of trauma for them. So those are the people that we saw. And in my year again, because we were in the army, it's a year Nelson Mandela died. So when his body was in state, we were instructed to go to where his body was in state, and we had to, if people needed us, we were there and available. So that I was very privileged to experience that.
Wow. And in terms of community service, do they place you? Can you do it anywhere, like your internship, or are there specific areas?
It's the same process. They give you a list of hospitals, and then you apply again to the hospitals that you think. I think you have to choose 3. And out of those 3...
But it has to be a public hospital.
100%.
You can't go private.
No, private, maybe that's we'll speak about that later. Your experience is in public.
Yeah, wow.
Your experience is in public.
Okay. And when you finish, then what happens? When you finish the community, do you write anything, or you are done now? You are a psychologist.
The only thing that you have to do after completing your ComServe, you go to HPSSA rather, and you have to register obviously as a registered independent practice. So you're no longer an intern, meaning you're a student. You're no longer done your ComServe. Now you're an independent practitioner, which means if you want to work in public, private, you can do your own thing. That's the last step.
Wow. Then you've got your freedom now to be a psychologist. So what does then the profession entail? Where can you work? What do you do? How's the profession?
So with clinical psychology, it's a bit more flexible, because you can work almost anywhere, not everywhere, but almost anywhere. So I was fortunate. After that, I joined this private company who did a lot of assessments. For the Road Accident Fund, which is obviously, again, in masters, something they teach you a lot, how to administer assessments, how to write reports, and I did that for a while, and then I eventually went back to government, worked for the government, where I still am right now, and the rest is history. And as a clinical psychologist, even what you are doing right now, obviously online, Even for myself, because of the work that we do, we don't just sit and speak to patients. You engage with the community in different platforms, social media. You get called a lot to community events. I think next week I'm called to a church. They've got an intervention there. So some of I think the women have written to the men in the church, and they want intervention. So you get called to things like that. And even in corporate, corporate is a place where a clinical psychologist can work and intervene there as well. In our country, we have a big substance use problem. So clinical psychologist, again, because it's extreme pathology, that's where a clinical psychologist can work in a drug rehab center. Currently, I get lots of emails every day from the UAE, from Doha, from New Zealand, and even sometimes the UK. People wanting you to apply for jobs in the UK because there's a need there for whatever reason. So I guess the world is your platform, and you decide where you want to punctuate yourself. Myself, I do a lot of radio work, sometimes TV, like yourself. I haven't written any books yet. I must join you there. Yeah, I'm getting there. So I enjoy the public speaking, especially radio, because what bothered me as a student, especially during those times, obviously in our country there's many psychological issues, whether they're political and for example, last year we had the riots. What does that mean? Understanding it from a psychological perspective. So I enjoy doing things like that.
No, look, I mean, just listening at you, like you are doing many things, and I think it's common in almost every psychologist I've met. I've never met psychologist who just does one thing. And what is it, because of the opportunities that are there, or the need, and because you also have your own practice as well? How does it happen that psychologists are too involved in so many things? What is the reason for that? Is it the demand? Is it they just have too much energy, or they suffered a lot in masters, they want a payback?
No, there's definitely a need. There will definitely a need in private and public. The psychologists who work in public don't just sit and listen to people's problems, especially the ones that work in the community. They go to the schools, they intervene at the school level. There's something called an intersectoral partnership, where we partner with the churches, where we partner with even sometimes traditional healers, where we partner with SAPs to address the psychological issues in the community. Because from a community perspective, if you're a psychologist in the community, you can't just see patients and sit and listen to their problems. We want to prevent the psychological issues in the community. So we have to go out. Sometimes, even this week, I did a home visit with a mental health worker, going into people's homes, you going to them instead of them coming to you, finding out what their issues are. And like I said, intervening at a school level, speaking to the child, KDLO teachers especially. What's the needs of the schools? What problems are you having with the learners? Before the problem escalates, before we get to more psychology. So it's very broad. Like I said, even in private, it's the same thing. Like you said, we have a new field. If you're a clinical psychologist, you can be trained in neuropsychology, which is a different field altogether. You're still a clinical psychologist, but you trained as a neuropsychologist. So you understand the brain. We're going where psychology is going now. It's more, obviously you want to be more scientific and understanding the brain. How does depression affect the brain? What does a depressed brain look like? What does a brain that has PTSD look like? So there's that field also. It's a new field in psychology. You're actually reminding me. My supervisor, or my psychologist said I must do it, and I haven't done it yet.
I hear that. This word supervisor is traumatizing. It's traumatizing. When you have done your master's and PhD, you don't want to hear supervisor.
Yeah.
So no, that's exciting. And tell me, if somebody is interested in clinical psychology, what kind of individual will you say might be able to thrive within it? Are there particular traits that you think will do well in clinical?
So, like I think we spoke about core values in the beginning. If you're a compassionate person, if you're an empathetic person, if you're a kind, caring person who puts other people before you, I think that'll put you in good stead. If you're the type of person who wants to make the world a better place, I think that'll put you in good stead. If you're a person who can receive feedback, or you can learn to receive feedback from the environment, from other people, you'd make a great psychologist.
And in conclusion, as we wrap up, I wanted to just speak to any kid out there at the Newcastle Primary, High School, but in Kobimva, Limpopo, who might be interested in following a career path in psychology. How will you encourage them, and what will you tell them if they're interested?
If you don't know anything, ask lots of questions. We live in a social media world. Lots of psychologists, including myself. On LinkedIn, I always have people asking me questions. When I can answer, I answer. So ask lots of questions, because the information is out there. It just needs to be accessed. If you don't understand something, ask, and people like yourself, like myself, are willing to share information. And maybe it's information that you don't like hearing, but don't be discouraged, because just because you're not a psychologist now, there's many counselors. A counselor can also have their own individual practice and work for themselves and do many things like a psychologist does, appear on radio and. So don't be discouraged, but ask questions. Go out there, put yourself out there, and ask questions where you don't know, because we can't know everything.
Thank you so much, sir. Thank you. I really appreciate that. Any other thing that you feel maybe we missed out that you want to share about before we close? Anything in your mind?
I guess maybe just a little bit back to master's training. A nice thing about master's training is learning about different types of assessments, which intimidates lots of people, but it's also very enjoyable. How to administer and write reports, which some people don't think is important, but as we've all found out as psychologists, it's very important to write good reports. And again, it comes from a research background.
Thank you so much, sir. That is the clinical psychologist, Mr. Mzamo Mbuli. Thank you so much. I really appreciate your time and what you have shared. I think this is very valuable. And anybody who wants to follow the career path, I think the knowledge you have shared can really help them in navigating their career. Thank you, sir.
Thank you. Thank you so much for having me.
Friend, thank you so much. I hope you have enjoyed the video, and I encourage you that share this video with other people who might be looking for jobs. Make sure they subscribe to this channel so that they can be informed about careers. There are many things that will be uploading. There are many videos that will be uploading in the coming weeks. You need to share this so that other people are also informed about career opportunities that exist, particularly in South Africa, where many people are not employed, particularly the youth. So make sure that you share this video. If you are not a subscriber of this channel, I encourage you that you take time before you close this video by subscribing to the channel. I told you that subscribing, you don't pay a thing. It's just a matter of making sure that every time I share a video, you will get that video on your phone. The video will come to your phone, you'll be able to see it that you have uploaded. So if you don't subscribe, you will not be aware every time I share a video. So subscribe by clicking the red button at the corner of this video. You must be on YouTube to be able to subscribe. Not on your phone, you might not see it. Make sure that you are on the YouTube channel, whether you are on the YouTube on your phone or your computer or your laptop, but make sure you are on the YouTube channel. If you got this link through Facebook or any other platform, make sure you are on the YouTube channel. click the link to go to the YouTube channel and subscribe at the bottom at the corner of this video so that you can be able to get more videos that I share. And also click the notification icon at the bottom, the bell. Click the bell and you'll be able to get notified every time I post a video. But lastly, make sure that you comment. Leave your comment at the bottom of this video. Your comment is a way to give me feedback so that I can be able to know how the video has assisted you, what you want us to improve on the video, what other topics you want us to tackle. If you've got any question, put it on the comment section and I will be able to attend to it. And remember, if you want me to share every post that I will be sharing every week with you directly, click on the link below here. The link is named email list. When you click on that link, I will get your email and make sure that I send you email of every position that is advertised every week. Whenever government advertise or any position that we get, I will be sharing it with you through that particular email. So leave your email and I will be able to share that with you. I hope you enjoyed and enjoy the rest of the day. And I trust that you will continue pursuing to live a fulfilling life. Let's continue living a life to the fullest. I love you and God bless you.